Hi, this is Dr. Beth Rosenberger from Appalachian Dermatology, and today we're going to do some microneedling. Here at the office we use Dermapen 3 to do microneedling, and I'll demonstrate how we do it, the products we use, and talk a little bit about benefits and before and after care. So let's get started. So this is actually Carissa's first time having microneedling, so she's in for a big surprise, but also I think it's good because a lot of times people say, oh, well, that's somebody who's used to it, or they've already prepped them, or they're doing it easy. But she wants it done for good, so we're going to do it right, and she's going to be tough. So for those who don't know, microneedling has actually been out for a while, and we'll talk a little bit about how it works and what the concept is and why we would want to put hundreds and thousands of holes in your skin. So first I'm just cleaning her. I cleaned her off with a little bit of water, and I cleaned her off with a little Cleanse because we are putting lots of holes in her skin. We want to make sure that there isn't any bacteria on there. Now she washed before we started as well, so I'm just giving it an extra good go over to make sure. Okay. All right. And next we'll be applying some Hyaluronic solution. So this is a hyaluronic acid solution. I'm going to have you turn your face a little bit this way. Try to give a flat solution. There's a flat surface to work on. So this is a hyaluronic solution. So this is a hyaluronic acid solution. So hyaluronic acid is the sort of jelly-like substance that makes up the, keep your eyes closed, just flashed it, makes up the deeper layers of the skin. And why we use that, number one, it just simply helps the microneedling machine glide better, and it also will help the hyaluronic acid to be infused as we work. Okay, so let's get started. So what do you think, Carissa? Gonna make her laugh. So what we're doing is we're gliding the microneedling machine or device right across her face. This particular device, I don't want to say it wrong, but I think pokes 1,300 holes per second in the skin, so it's vibrating up and down as well as rotating around as it goes. So the reason why we would want to poke a gazillion holes into somebody's face is because it helps stimulate new healthy skin to grow. So we know this based on some science that's developed over time. So many years ago, when I was still in residency, we frequently did a procedure called CO2 or erbium YAG resurfacing. So that was using a type of laser that targeted water in the skin. In those cases, it would, go ahead, turn your head for me, by targeting water in the skin, totally remove a whole layer of the skin. So it left the person sort of down to raw meat. Well, what happened though, unfortunately, the point was to develop a whole new, brand new layer of skin, and indeed it did. But often that new skin didn't have any of the normal texture or structure that skin normally had. It was actually often just looked like scarred skin. And you can still see, particularly usually you'll see it in older ladies because it hasn't been done so much lately. Usually we're talking about people in their late 60s up to late 70s, early 60s, late 70s, who had this done. Often it left an ivory white, almost scarred-like look to the area where it was done. So that wasn't very good. And there was also lots of scarring and lots of risk associated with that procedure. Lots of infection risk and, like I said, scarring risk. So since that didn't work so well, then followed a type of laser called erbium YAG and fractional resurfacing. So in that procedure, Instead of removing a full surface of the skin, what those lasers did is that within, say, a given square inch, it would poke a number of, quote unquote, poke a number of holes with the laser in that given area. So in any given area, say, just for example, with a fractional laser within a square inch, it might poke, say, 30 holes with the laser. So instead of removing the whole surface of the skin, it did small micro areas. The idea was that we would generate new skin up through those areas so that new healthy skin could grow up through those areas, but still leave some normal skin intact in between. By leaving some normal skin intact, you will retain some of the normal structure of the skin. Well, the problem with that is that fractional lasers, and any laser, the laser absorbs energy in the skin, which is simply described sort of as heat. So the problem is you couldn't put those little holes, quote unquote, so close together with a laser, because if you did, in essence, it just sort of melded into one solid sheet again. So you could only put them so close together. So enter microneedling. So with microneedling, what we're able to do is to poke again. Now this forehead is the most sensitive area, in my opinion, for most of my patients. So if she winces a little bit, we won't give her a hard time. So enter microneedling. So with microneedling, we're able to poke hundreds and thousands of holes in the skin. We're able to do it in a very controlled way with a very, very small needle. And we're actually able to poke lots more holes in the skin because we don't have to worry about the heat causing them to sort of run together like we do with the laser. So again, the goal with microneedling, just like with some of these older procedures I've been talking about, was to develop and generate new healthy skin to grow up in these holes or channels. Which brings us next to sort of, as we're getting closer to the end of the procedure, we're going to talk about the channels. So as we, and the nose is sensitive as well, so but we don't want to skip any areas. So as we needle the skin, it makes little channels in the skin. And you can see, if you could zoom in, she flinched a little bit there, it is sensitive over the nose as well. There are a few places where there's just a tiny little bit of bleeding. There's a few little spots here. And if we hit right over a little blood vessel, there's a tiny little bit of bleeding here on our nose, it can bleed a little bit. But that's okay. No big problem. The channels on the skin actually remain, I'm just checking to make sure I didn't miss anywhere. The channels on the skin remain pretty open. We're going to go right over her glabella real quickly. Here we go. The channels of the skin remain open for about 10 or 15 minutes. So we now know that from this point onward, we have a chance to infuse those channels with all kinds of goodness. So as I've been doing the procedure, I've actually been infusing it with hyaluronic acid. And again, this is the normal, are you okay?
Yeah, it's not too bad.
Okay.
Yeah.
Infusing it with a normal jelly-like material that's in the deeper layers of the skin. So hyaluronic acid is in some of the fancier moisturizers as well. So we're not just putting it on the outside, we're infusing it into the channels that are being developed here. Then, following that, we have a series of other topical agents that we will apply. And I'm just using up the rest of this hyaluronic acid solution that I didn't use during the procedure because I don't want any of it to go to waste. I'm not sure I went over your upper lip, but that's not a real problem area for you. And I was trying to be, do you want me to get it?
Yeah.
Do it?
Yeah.
Okay.
Yeah. It actually didn't bother me hardly at all around my mouth. It was sort of relaxing.
Okay, hold still. You look pretty relaxed. That's why I said, are you okay? I didn't know if you were like fainty relaxed or really relaxed. We're actually going to go over that area twice since we can't really go up and down very well. Okay.
Yeah, it was
Fine
not
there?
bad there at all.
Okay. So there are a number of products that the company who makes our device supplies for us to apply after the procedure. So the first one we're going to use is one called antioxidant cocktail, and this just has a number of antioxidants, and again we want to infuse all this into the pores while they're, or the channels, not just the natural pores on the skin, but the channels that we've created with the microneedling device while they're still nice and open. There is a package that we have here at the office that includes a number of these products as well. I'll show you a picture of that at the end for you to take home. We recommend generally that people use the products, set aside their other things and use these products for about a week. That way we can make sure you're not using anything too harsh on the skin, and again that we're just nourishing it as much as we can during the recovery period. Then after about a week, we let you go back to your regular regimen, assuming you don't have any irritation.
Call for an appointment today and learn more by going to our website at wvderm.com.